Demonstration we are going to show now is initial approach to critical ill patient. This is ABCD approach in a systematic manner. This demonstration would be in two stages. The first stage would be a live scenario, and the second stage would be explaining each step in detail. Good afternoon.
Good afternoon.
I heard that you are the on-call doctor today.
Yes, it
Right?
is.
So we have a patient in the HDU admitted with a central chest pain of 2 hours duration. His name is Mr. Pereira. Could you please go and have a look?
Yes, sure. Mr. Pereira, who is 50 years old, admitted with central chest pain of 2 hours duration, who is currently at the HDU. Miss, shall we go and have a look at the patient? Good afternoon, Mr. Pereira.
Good afternoon,
I am
doctor.
one of the doctors here, right? How do you feel now?
I don't feel very well, doctor.
Yeah, what is happening?
I'm having pain in the middle of my chest,
For how long?
maybe for a couple of hours.
Yeah, do you feel any difficulty in breathing?
No, doctor.
Is the pain is radiating to anywhere?
No, doctor.
Miss, can we put oxygen 15 liters via an unrebreathing mask? We are going to put some oxygen to your face,
Okay.
right? That will help you to breathe, right?
Thank you.
Mr. Pereira, I am going to examine and see, right? But if you feel any discomfort at any time, just let me know, right? Yeah, the respiratory rate is 16. Trachea central. Chest expansion equal in all three zones. Percussion note normal in all three zones bilaterally. Can you breathe in and out nicely for me? Auscultation is normal in both sides or in all three zones. Miss, can you take a saturation reading for me? Miss, can you connect the patient to the cardiac monitor? Peripheries are formed 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 1 in 1000, 2 in 1000. Capillary refilling time 2 seconds. Radial pulse, good volume, regular. The rate is 76 beats per minute. And after that, get a non-invasive blood pressure reading as well. And insert IV cannula and take blood for investigations. Full blood count, serum electrolyte, creatinine, a VBG and cardiac troponins. We are going to insert a small needle into your hand, slightly painful, but through that we are going to give you drugs. Right, Mr. Pereira?
Okay, doctor.
And then give IV morphine 3 milligrams. And then start a normal saline drip. Okay, the drip started. Okay. Okay. Give a call to a ECG for a 12 lead ECG with a rhythm strip. How do you feel now?
Still the pain is there, doctor.
Shall we give sublingual GTN 0.5 milligrams? We are going to give you a drug. Keep it underneath the tongue. Don't swallow. That will relieve your pain further, right?
Okay, doctor.
How do you feel, Mr. Pera, now?
Little bit better, doctor.
Okay, patient is conscious and rational. Can I have a torch, please? We are going to flash a torch into your eyes. Don't worry, right? Pupils 3 millimeters equally reacting to light. You check a capillary blood glucose of this patient. You will feel little bit of pain in your finger, right? We are going to prick a bit to check the blood glucose.
CAP is 105, doctor.
Thank you. We are going to expose you and see further, right, Mr. Pereira? And meanwhile, can you check the temperature of this patient? There are no scratches, no bleeding, no ankle edema. Do we have the temperature?
Temperature 37, doctor.
Yeah, temperature 37, thank you. Do we have the ECG now? Mr. Pereira, your ECG shows some problem in your heart, right? So we'll call the heart doctors and they will look after you, right? Don't worry.
Okay, thank you, doctor.
Good afternoon, Mr. Pereira. I am one of the doctors here. How do you feel now?
Good afternoon, doctor. I'm having chest pain, doctor.
For how long you are having this chest pain?
For about 4 hours.
Does it cause any difficulty in breathing?
No, doctor.
Does it radiate into your head or?
No, doctor.
Yeah, the patient is talking nicely, who is conscious and rational. That indicates the airway is patent. So we are going to put oxygen via non-rebreathing mask at a 15 liters per minute. Miss, can we put oxygen 15 liters per minute with a non-rebreathing mask? We are going to put some oxygen through a mask that will help you to breathe nicely. Right. Then I'll move on to the part B, the breathing. So starting with the respiratory rate, which is 16 breaths per minute, and then the tracheal position, it is central. Chest expansion in all 3 zones bilaterally, which is equal, and then the percussion note, both sides in all 3 zones, they were normal. Then the auscultation in all 3 zones bilaterally, and asking the patient to breathe in and out nicely. Can you take nice breaths for me, in and out? Yeah. The auscultation is normal in all 3 zones bilaterally. And then we'll check the saturation of this patient. Miss, can you put the saturation probe and get us a reading?
Okay.
We'll move on to see the circulation. So at the beginning, I'll ask the nursing officer to put the cardiac monitor. Miss, can we put the ECG and connect to the cardiac monitor? While she is doing that, I'll assess the rest of the part C, whether the peripheries are warm or cold, and it is warm, and capillary refilling time. 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 1 in 1000, 2 in 1000. It's 2 seconds. And then the radial pulse. It's regular, good volume, and the rate is 72 beats per minute. Miss, can you get a blood pressure reading? And the blood pressure is 152 by 86. We'll insert IV cannula, but before that, always inform the patient that the patient will feel a sharp sting. Mr. Pereira, you will feel a sharp sting, right? We are going to insert a cannula, right? Can we insert a IV cannula and take blood for investigations? So after inserting the cannula, we'll take blood for investigations, full blood count, serum electrolytes, serum creatinine, and a venous blood gas. And since this patient is having a chest pain, we'll go for cardiac troponins as well. After taking blood, we'll give morphine 3 milligrams IV since the patient is having chest pain. And after that, we'll start a normal saline drip. Miss, can we give morphine 3 milligrams intravenously? And then start a normal saline drip. Since this patient is having chest pain, so we need to take a 12 lead ECG with a rhythm strip. Miss, can you call for 12 lead ECG for this patient? So we have given morphine for this patient, then we have to ask from the patient whether the patient is still having pain, whether it's relieved or not. Mr. Pereira, how is your pain now?
It will be better.
Yeah, do you still have pain? Yeah,
Yeah.
it has responded but still having pain. So since it is suggestive of cardiac origin, we'll give GTN sublingually and make sure you tell the patient not to swallow, just to keep it underneath the tongue. Miss, can we give sublingual GTN 0.5 milligrams to keep underneath the tongue? Mr. Pereira, we are going to give you a drug, keep it underneath the tongue but don't swallow it, that will relieve your pain further.
Okay, thank you, doctor.
Then we'll move on to D, the disability. So we'll talk to the patient, see whether the patient is conscious or not. Mr. Pereira, how do you feel now?
Hi, doctor. It will be better.
Yeah, patient is talking nicely, who's conscious and rational, that indicates the GCS is fine. And then we have to check the pupils. Yeah, can I have the torch? Mr. Pereira, I'm going to flash a torch into your eye, right? Don't worry. Yeah, the pupils are equally reacting to light, 3 millimeters in size. Then we'll check the capillary blood glucose. Miss, can we check the capillary blood glucose? Yeah, you will feel a small sting. Don't worry.
Doctor, blood sugar, CB is 105.
Yeah, capillary blood glucose is 105. Then we'll move on to part E, the exposure. So before exposing the patient, explain the patient that we are going to expose, but make sure we put the curtains. Mr. Pereira, I'm going to expose you and see further, right? There are no scratches, no bleeding, no ankle edema. And we have to check the temperature of this patient. Miss, can we check the temperature of this patient?
The temperature is 37.
It's 37 Celsius. Do we have the ECG? Yeah, the ECG shows anterolateral ST elevated myocardial infarction. So we'll inform the patient that the patient is having a cardiac insult. Mr. Pereira, you are having a issue in your heart, right? So don't worry, we'll talk to the heart doctors and they will look after you and ensure the patient that the cardiologist will look into your patient and do the necessity.